professor, physician, epidemiologist. I am Dr. Sri Banerjee.
I'd like to welcome you. My name is Lita Downs. I'm with the Office of Teaching and Learning Excellence, and it's great to see everyone in the room tonight. We have quite a large crowd, so welcome. Today's session is Transforming Social Research to Policy Using Healthy People 2030, where the rubber meets the road. On the line, we have Dr. Sri Banerjee and Dr. Nina McCune, and they're going to be presenting this information through the next 45 minutes. Before I hand things over to our wonderful presenters, I would like to let everyone know on the line, those who are part of the College of Nursing, this session qualifies for nursing continuing education credit. Walden is accredited as a provider of nursing continuing professional development by the American Nurses Credentialing Center's Commission on Accreditation. We'll have another slide at the end of today's session so you can know how to claim those hours if you are part of the College of Nursing. Without any further ado, I'm going to turn things over. Welcome, Dr. Banerjee. Welcome, Dr. McCune. So great to have you on the line.
Thank you, Lida. Thank you for that wonderful introduction, and it's really great to be here. You know, I often say that if, after my name, you might have recognized I have MD and PhD. So I often say the MD is there for multidisciplinary. But I've been, you know, my background is from medicine, and then I switched over to public health. So a lot of what I shared today will deal with some of that. And also, you know, I've been working with Nina on this, and so I'll let Nina introduce herself as well.
Well, hi. Many of you know me from inclusive teaching and learning, and my background is also multidisciplinary. I have a background in social sciences and history, as well as foreign language, but post-secondary education holds my heart. So I'm really excited to be here with all of you tonight.
Great. And I just wanted to add here, this picture is actually from Tampa in January of 2020. And this was the last time, if you recall, you know, in the national faculty meetings, this was the last time we did not need to wear a mask. And we were able to teach, we were able to, you know, disseminate information and have discourse during conferences and you know, do all of those things that we so dearly miss right now. And so I wanted to have this up so that we can all think about those fond memories. So next slide, please. So when we're thinking, you know, when we first started thinking about this, and actually, you know, we have been working, Nina and I, on several diversity projects and everything throughout. So some of these things we've been discussing as well, but the bottom line is to think about some of the social issues, food insecurity and hunger. These types of things were really rampant within the community. People were struggling to make ends meet during the beginning. If you remember, you know, there were so many emergency shutdowns, and people didn't know how. People really didn't know how to cope. And so there really needed to be a lot more work done. And so within the community, what I decided to do is start with a letter to an editor in 2020 and appeal to the local newspaper to make people aware of such a critical need such as food insecurity. It's part of the 5 domains in social determinants of health. And so this was something early on that was important. But you know, Nina, I think even in your community as well, there are a lot of shortages, right?
Absolutely. I live way up in northern Minnesota, right on the Canadian border. And we noticed, just scarcity within the grocery store because of supply chain issues. And the lines for the food distribution were long, not because people couldn't afford groceries necessarily, but because we just simply couldn't get materials up here. And so it's a little bit of a different way of thinking about how fragile our systems are, and ways that we can start to bolster and become advocates for each other in unpredictable times.
And to add to that, these are the types of things that we need to see what our students are experiencing and help our students through struggling times. If there are areas where students may need some extra deadline consideration, things like that, these are what we're here to discuss. So next slide, please. And so this and actually the next slide as well. This is part of actually this presentation in that part of what we did is it's the advocacy that was initiated by the Society of Public Health educators, and that actually was something to do with commenting on not only social determinants of health, but also Healthy People 2030 and where that intersection is. And this letter in particular was actually appealing more towards newer objectives. And so a group of us got together, Nina and I and others, some of us included, signatures on this, others actually had their own initiative and provided their own letters. So what I had done actually on LinkedIn provided details on how to exactly visit this website and what types of comments they were looking for. So advocacy, advocacy is another important area where we can really help students out and really allow what is in the social determinants of health framework, all the critical domains, all the critical pieces. How do we bring it to fruition? And we throughout this hour, throughout this 45 minutes, we'll be showing you key ways, key takeaways that you yourself, can take away, and then also within your classrooms implement strategies. So be looking out for these as we go through these. Next slide, please. So this is, again, as a reminder, just a quick reminder, this was findings from a presentation last week. Anxiety is something that is, very much within the general population, but related to COVID, this was, kind of amplified. And so as you see, if you look at a combination of anxiety and COVID, the percentage was 31.7%. So again, how does this apply to our students? We really need to do things, to improve the student experience. And that is what we're here to discuss. How do we bring this to action? Next slide, please. Okay, so and then so Nina, so I guess the areas that we'll discuss here are building on resiliency, right?
Absolutely. And I think it picks up on that theme earlier that you highlighted, that we do live in times where things are hanging in the balance. They are quite fragile, and so thinking about how we can become stronger advocates, how we can become stronger allies, show that we care for our students that much more is absolutely heightened. One of the main tenets of the social determinants of health, which is something that's starting to enter our vocabulary at Walden, is access to quality education. And I think that's obviously our wheelhouse, and that's what becomes really most accessible to us. And there's something else that's kind of interesting that's related to that. Our colleagues at Chamberlain have developed what's called a social determinants of learning, where they focus on equity-related educational justice and social change. And I think, that's something that we need to consider as well, not necessarily just straight out adopt a framework that might be tailored for one educational institution. But we do have a broad social change vision and mission. And in order to drive actionable social change, we want to then talk about this larger initiative that kind of houses both social determinants of health, social determinants of learning, these issues of equity, whether it's health equity, educational equity, under the umbrella of Healthy People 2030. And that's not that long away, right? That's 8 years. If my math is right, rarely is right. But the point really embedded in everything that we're going to be presenting is not a multidisciplinary, not an interdisciplinary approach, but a cross-disciplinary approach, that we can learn from each other, and our strengths in our individual disciplines can go a long way toward meeting the objectives for Healthy People 2030, which is a data-driven national set of objectives to improve the health and well-being of all of us. So it's a very exciting time. The mandates are real, the mandates are immediate, and the mandates are actionable. So these aren't things that are completely abstract and undoable. I think we have great opportunity for growth in these areas.
I agree completely on that, and to illustrate that point that Nina just mentioned, the yellow cab is what we have created as the symbol for Healthy People 2030, and we'll be expanding on that in a slide in a couple of minutes. So so that this is just a preview, and you'll be seeing that this icon appear in multiple slides, so that we can kind of show you the progression of ideas. Next slide, please.
So we are hoping that today we can begin to understand how Healthy People 2030 can apply to and transform research into policy. And that's something really important, is to translate what we do in our classroom, what we do with our students, into something actionable and practicable for them, for their communities, and possibly for the broader community at large. We want to show a couple of examples of how social determinants can be presented as objectives, and explain the importance of social change in creating policy. And once again, we have the taxi that might be driving us home on this. I don't know.
Great.
Next
okay,
slide,
so next slide.
So we're going to start off with a question for you. You please feel free to put into chat of a time when you've had a productive conversation on diversity and your discipline, whatever it is, in a discussion, and describe what context. Was it the students or the course topic or your awesome skill that made it all possible? And don't be shy. Go ahead and brag on yourself, brag on your students, brag on a colleague. I think it's really important that we start to look at what we collectively do well, where our strengths are, in order to build upon these really important mandates, these imperatives that we have that are supposed to be realized within the next 8 years.
Okay, I think the next slide has the question as well. So I just the visual on the left, by the way, was a visual that I had created in terms of kind of illustrating some of the processes taking place. So evolving change, and so the idea is sometimes when we're understanding the effect of whether it's change or whatnot, it's almost a trifecta. So you have an effect and then you have so you have an outcome, and then you have something explanatory, and sometimes something in the middle. So that's that dynamism. But as you're thinking about the question, we're interested to see if there are any sorts of conversation, dialogue, that you can think of.
If you can't think of it now,
And
please keep it in the back of your mind, like have it be a running question. And yeah, if you could put something into chat, that would be great. And if you don't have something right off the top of your head as we go on in the presentation, please feel free. Whoever, if Shri is talking and I'm not, I'll monitor chat and vice versa. So we will definitely incorporate your comments. Dr. Donna Bailey. Many of the class discussions in nursing that we have utilize diversity as a starting point. The topic surfaces naturally because of the diversity of the students themselves. It's awesome. And I think that's such an important thing that we have as a huge plus as Walden is the diversity of our students. Not only who they are, but where they're from, where they work, how they spend their days, right? If they have a small family, a big family, and it's an exciting process, right, of incorporating many voices to tackle really complex issues. And I can't imagine what nursing discussion forums look like right now. That the pandemic is just going to be here for always.
yeah, I think there's a lot of good discussion, and I know we will be talking about some of these things. So definitely keep on listing your ideas and thoughts. These are really interesting. And I think we can revisit this as well, some of this at the end as well. But definitely very thought-provoking ideas starting to come in the chat box. So that's great. I think, so next slide, please. Great. Okay. So what are some of the things that we should be considering, and again, dividing things up into three is easy to remember. So we want to think of, considering federal policy and how the guidance can impact Walden students, right? So on a broader level, but also explore what ways Walden faculty can engage and support those students, and then create curriculum surrounding that. So all of these are extremely important, and we'll be covering that. Next slide, please.
So this image is from UCLA Health, and it takes a slightly different angle on social determinants of health, and it breaks social determinants of health into kind of four main factors. And so the distribution is something that they determine, not me. But in the social determinants of health, we look at factors like, and I think the slide is animated. Lita, would you mind clicking? There you go. Like these socioeconomic factors of education, economic stability, social and community context, physical environment, and healthcare. Social determinants of learning take a different kind of stance on this, using the same socioeconomic factors and physical factors. The outcomes are different. Social determinants of health seek to improve health, well-being, and quality of life, while social determinants of learning seek for educational justice. And the actor for the social determinants of learning are education institutions rather than whole populations that would benefit from the social, or from incorporating aspects of well-being. And so I think as we go forward, this new language that we're all learning at Walden, I think it's really important to keep in mind that the social determinants of learning have kind of this extra layer of justice, fairness, equity, and it applies specifically to educational institutions like Walden. You can go to the next slide, please.
So when Nina was telling me about this, and we were discussing this, and the percentages, I felt like the percentages were things that I had seen somewhere else. So this resource, so County Health Rankings, is actually a health resource that and geospatial applications is very useful. There's a treasure trove of information about each county. And the breakdown of the information that is there's a list of a lot of variables, 30, 40 variables. So this model, there's actually a model from the county health rankings, an important one, which shows the breakdown of various types of health, and also the health outcomes. So when we're thinking about social and economic factors, the things that we have been talking about, we talked about food insecurity, we talked about the things that affect students socially, that's about 40%. And of course, everything within the society, we always, whenever I have students and they're in the dissertation stage, I'll tell them, you have to have family support or some sort of social support system so that you can actually feel, a sense of belonging and feel like you are a part of the community. So these are important, but also it's important to understand health behaviors. And so I know with my conversations with Dr. Bruce Reagan, he talks about locus of control, and that has to do with health behaviors, and that is 30%. So clinical care and health behaviors, that makes up about 50%. So I think when we're discussing semantics and discussing about this new language, it's sometimes good to keep in mind the percentage as well. Just roughly a rough estimate of how much this really impacts populations and individuals and just the whole gamut. And so this is where, if we translate to students, we can make some really good conclusions about what percentage each plays a role. Next slide, please.
So when we start to think about our students at Walden, and we start to think about this kind of overlay of social determinants of health and social determinants of learning, if we break apart these factors of socioeconomic factors, physical environment, and health behaviors, there's a whole host of questions that we can ask as educators about where our students come from, what are those socioeconomic trends, what kind of social environments generally would those students come from. We can, for example, if we want to ask OIE for zip code data to understand what their physical environments could be like. We have plenty of databases that are freely accessible to all of us to go zip code by zip code to understand what neighborhoods look like in the United States. Health behaviors is a weird one for us. We are not an on-ground school, save for residencies, for example. So the physical health of the student kind of falls outside of our view. But the thing that's interesting in the social determinants of learning is this idea of self-motivation. In the field of education, we can talk about Bandura all day long, right? In terms of what motivates a student to complete. I think there's a community approach that we can think about at Walden in terms of being advocates and allies with our students to promote their wellness and to let them know that we are part of that support system to help them continue on in their studies. So the overarching question is, how can we achieve some modicum of educational justice? And I think this is something that we're going to have to unpack over the next few years. Not only are the definitions of these terms rather loaded, but understanding who our students are, I think, is a little bit more than saying, X percentage of our students are African-American females that graduate in X percent of time. There's, I think, a lot more to the understanding their context and the communities that they come from, that they're eventually going to go back and serve. Next slide, please.
This is a clip I wanted to visit, and I think it's important to revisit the good work that has already been done, you know, and it's been described. Social determinants of health has been described in multiple ways, and from public health at Walden. So this is a minute clip from that.
Concept of upstream, which is social structure like healthcare systems, labor markets.
Okay. I think. Okay. Pause.
Okay.
Yeah.
Downstream, which is more of the individual, which they refer to as the micro. But then there's this little piece they throw in there that hedges on this whole thing. And this is what ticks me off about researchers. They throw in this thing called meso, which basically puts us between the two extremes. And they are the neighborhoods, the workplaces, the families, etc. So we say it depends because so much of it is about our perspective. If we're coming from a health promotion and education perspective, we're going to look at it different than we come at from medicine, or we come at it from healthcare, or we come at it from even long-term care. We're going to look at the upstream, downstream, and the meso part of it, and we're going to see, well, yeah, in these situations, okay, this may apply. And in this situation, this may apply.
Dr. Reagan has a way with words. The way he's able to describe that, I couldn't even begin to describe it in that way. And so I felt like it had to be presented from his voice. So and he summed it up really well in that clip. You know, this is social determinants of health are extremely important. There's upstream factors, there's downstream factors, and he uses a river analogy to explain that. And so now, you know, what next? And he goes on to explain the idea of locus of control, you know, and how it's important to have external locus of control, identify those external loci, and then make them internal and try to understand the difference. So as you can see, you know, components of individual well-being is in there as well, and also emotional health. Some of those things are additional areas that can really bring, you know, social determinants of health, a wonderful, wonderful framework to fruition. You know, it can really have the rubber meet the road. To revisit that that analogy. Next slide, please.
So in the social determinants of learning, and I'm just going to very quickly go over this, they start to kind of formulate, or they tease out various sub-aspects of social determinants of health, but it's surrounded in an institution that brings forward diversity, equity, and inclusion. And that action happens under the auspices of the faculty and the curriculum. And that's why we wanted to, you know, talk today about what we can do to activate the social determinants of learning and social determinants of health at Walden. Next slide, please. So something, when we talk about context, it's important to keep in mind that the majority of our students come from the southern part of the United States, specifically the state of Georgia. And whereas the images that you're seeing are about civil rights during the 1960s, which are often violent and public displays of racial hatred, these are intergenerational issues that don't go away just because there was a Civil Rights Act or a Voting Rights Act that was passed shortly in this period. And we have this slide up simply to remind where these students come from has deep embedded disparities. The changing legal statutes of Jim Crow And what made this kind of violence absolutely acceptable and almost socially necessary haunt us today. And I'm saying this in light of the fact that we just honored Dr. King's birthday on Monday, and we are still debating access to voting in the United States. So these kinds of contexts are things that we really have to keep in mind. And I saw in the chat, quite a few of you are mentioning this idea of racial disparities, whether it's in terms of special ed placement or Indigenous language fulfillment. We have to absolutely remember this is part of our lived context and our students. Next slide, please.
So as you saw, we have a framework and 5 domains identified, social determinants of health. We've talked about social determinants of learning as a translatable framework for education, but how do we bring it to action, right? And so we're getting to the CAB soon, but let's see what Google would do, and what would you do? Think about it. Next slide, please. So going towards what would Google do, and what a lot of companies, what are the types of solutions that a lot of companies are looking for? Well, if you look at precision medicine, and the application of artificial intelligence, and how trying to use multiple potential markers to better use targeted therapies to improve health. Right. So this is what precision medicine is, according to the CDC. And there has to be a way to kind of have all disciplines, be a part of this. And precision medicine and this kind of philosophy is an important one to understand. Next slide, please. So if we translate what we learn from precision medicine, creating prediction scores, to what Google is doing to help through direction, guidance, helping with the next doctor's visit, appointment, things like that, improving well-being. So these are really, actionable examples, AI models, which can be created to help guide students, which in fact has been already implemented in certain areas of Walden, some artificial intelligence. Next slide, please. So, there's been models. I've also developed model scoring systems, predicting, for instance, not only looking at achievement, but also looking at certain student characteristics. So, for instance, leadership characteristics. Does change adaptability, and this is actually on my website, does change adaptability affect leadership abilities? And so this was from student data that was collected over several years, and a grant-funded study that myself and other collaborators worked on. And then also, Nina, the Walden Changemaker system.
Oops, I think we all recently received an assessment from Ashoka, and that was from the Center for Social Change, that measured our engagement with social change. And I know that Isaac Kudjo, the director of the Center for Social Change, will be sending out the results of that assessment very soon. But what it enables us to do is to see where we generally might fall flat, what areas we could benefit from other training, or strengthen our curriculum. And so it's an exciting tool.
Excellent, great. And next slide, please.
So as we mentioned earlier, there's a language forming in Walden about the social determinants of health. And this language is not new, right? It's been around since at least 1848. These next images kind of show the evolution of how the social determinants are strongly located in the social sphere, which in and of itself is super complex, right? We are governed by any number of systems, our beliefs, our practices, our cultures, our languages, what have you. And these are all the things that make us whole and make us well. And so in this set of images that's kind of flashing by right now, these structural components are things that we can change, not change, we interact with, but education is absolutely always part and parcel of it. Our colleagues at Chamberlain have developed a framework around this that I mentioned earlier. It's something that kind of all ties together in this new language that we're learning. Next slide, please. So in this map, and so Deborah and Meta, this is one way to look at the world, right? In kind of geospatial imaging. This map is from what's called the Opportunity Atlas, and it's from a group at Stanford that's headed by Raj Chetty. And they have unbelievable amounts of census data that they got access to. And they put together this map, and there's all sorts of drop-down menus that you can fiddle with, household income, education level, all sorts of census data, plus contemporary things like unemployment status, incarceration rates. And they use this modeling at Stanford to predict then what the likelihood is of children from neighborhoods, street by street, what their likelihood is for social and economic mobility to increase over their lifetime, based on the factors that we have available to us through the US Census. The Opportunity Atlas is absolutely a tool that you can use in your classroom, that you can throw in a discussion forum, have your students noodle around with. I think it could inform a lot of really great work. They've made it incredibly accessible and very easy to use.
Could not agree more to the last resource. And so I'll add an additional resource, which is looking at redlining. And so I'm just going to quickly describe this concept, a very, very important concept. But what happened is that during the 1930s, real estate agents and others were actually disinvesting in certain areas. And I use that term. It's kind of a complex term, but what it means basically is that certain areas, businesses were not actually taking out loans and so when we think about food insecurity, food deserts, the lack of fresh fruits, vegetables, things like that, and many other things, redlining, you can most times see is behind all of that. And so many times, historically marginalized populations and individuals were the ones, neighborhoods were the ones that were disinvested in. So currently, actually, you would think that because it's in the 1930s, the effects are not felt to this day. But the reality is that when you're describing and when you're thinking about broadband access now, right? So fast forward into the 21st century, we're seeing some of the similar issues in some of the same geographic locations. And so in Wisconsin, these are some of the patterns that you're seeing. So in the same areas, if you see, almost from the patterns, you can immediately see that the same areas that have gaps in broadband are also, and these are redlined areas, are also the areas where less than 1 in 2 own homes, right? 1 in 4 children are in poverty. There's more than 1 in 8 that haven't completed high school. So these are effects that you can see on various maps, and you can see the associations. Next slide, please. Okay, so we were talking about kind of the distribution of where Walden students live within the United States. So one such way is by doing a relative search volume. And so this technique is actually a bit complex and beyond the scope of this presentation. But in my conversation in the Beacons of Light with Dr. Sue Subak, I actually describe this technique. And so you can find the details of this in my website or in some other places as well within my YouTube channel. Also, we're going to be getting to this cab now, which is on the top left corner. So next slide. But I also wanted to, okay, so you probably saw in the previous slide that also some of the patterns, some of the same geographic patterns of concentration of Walden students that Nina was mentioning in some of the earlier slides. So we talked about this process. Next slide, please. Okay, next slide, please. Okay, so I'm going to quickly mention here. So Healthy People 2030, what is so crucial, critical about this? And one of the major factors here is that before, when Healthy People was first being presented, there was not as much practicality because there's thousands of objectives. You couldn't go through the list of objectives in one city, so they decided, working groups for years decided and talked about this and thought about what would be the most critical number of objectives. And when Nina and I were trying to figure out the most critical number of slides, that took us a long time. That would be best for this presentation. So I can only imagine what those conversations sounded like when they were thinking about how to make it practical so that people can use it. So the number of people settled with was 355. These were the number of objectives that collectively was decided. And so what these objectives, why this is so important is because what these objectives did is specifically went in and informed each one of the social determinants of health methodically, right? So I felt like when I was reading, a lot of the social determinants, I didn't kind of know what to do with it, right? So reading this is like the primer to tell the instructions, right? The recipe telling you this is how we can implement this. So in education, how this applies is we can really use what we learn from Healthy People 2030, the action-oriented objectives, and either kind of apply it to education or create something similar that has that action focus. So again, life expectancy, well-being, and outcomes, right? So there's 8 broad health and well-being measures. So these are the ones. So I summarize it in this this type of organization. It wasn't organized in this way. I felt like this was a better visual, so we organized it this way. So next slide, please. And then the overall framework, right, is comprised of 4 items. So the vision and the mission, of course, is important. The framework, it has these 4 items, but the foundational principles, overarching overarching goals, and then plan of action. And this is where plan of action is where that fruition takes place. Next slide, please. Okay. So this was a Go picture. 2020 represents a break from eye strain. So a lot of times, when you're involved in computer work or when you're watching an interesting presentation and you're glued to your screen, you forget to blink, And so it's good to remember sometimes that to look away from your screen 20 feet for 20 seconds, take a little, just a little eye break. And so that kind of helps to refocus, right? And this is from a local pet store, local petting zoo, and this is a cute goat, and so that's kind of take a break right now. And then next slide, please. So here's the debut of the cab that we all have been waiting for this evening. And there's a lot of parts to this, but the really important elements of this is the fact that this is in motion. First of all, dynamism. We started off with this. We have to keep it moving. We have to make sure that students and individuals that are coming from their own communities, they're living in their communities, they're going to schools, make sure that when they are entering, higher education, higher learning, when they're entering Walden, they're also getting, kind of educated about social determinants of health, but also about the fruition, how to bring it to fruition. So not only within their curriculum, but also they will, students will be supported by the initiatives of Healthy People 2030, and this then they take it back to their communities. So so how do you do that? That is the question. And so Healthy People 2030 is on the door, and that is the lens. That is the access point for the social determinants of health. This is how you access. So here's the vision, and a society where we can achieve full well-being, overall health and well-being, and when it's students, full educational attainment, right? So next slide, please. So I know this is a lot of words, but highlighting, evidence-based, accurate, timely, accessible, and Nina, did you? And then the next two maybe.
Yeah, I think, so a plan of action in Healthy People 2030 does kind of what we do in research already. We look for evidence-based practices and policies, programs that can give us the best data to make the best decisions. There's an emphasis in Healthy People 2030 that's really interesting, especially between public-private partnerships. And I think, there might be an opportunity for growth in this area for us. And the kind of the final plan of providing tools for the public, every bit of research that we do, every bit of research that our students do can go back to serve the communities that they ultimately where they'll be working. And I think this plan of action is, I'm going to just say it's a noble one. And I think that the aims are great. And the imperative for us is really clear. Next slide, please. The imperative for us is to make this sustainable. And I want to just kind of pause for a second. There's a great question in the chat from Deborah Inman about, how are we supposed to focus on this when there's so many people that are still in those food lines, right? That are still trying to figure out, how to make their own families sustainable from month to month. And I think it's something to really consider at this time. It goes back to the fragility of our social systems and our social structures, and the advocacy that we can offer our students just in our own little microcosm. And I think that is one key where we can act sustainably. I hope it's one key where we can act sustainably. But I'm hoping through practices that we enact, and I've gotten to know many of you that are here tonight, to do that, you're already doing such cool research and you're already putting out such really interesting work that I don't see how we can't be a part of Healthy People 2030. I think we already are. So I don't know, maybe I'm a little bit too much pie in the sky, but I am very optimistic for this collaboration. Next slide, please.
So the four-step process that I was telling you about, understanding and implementing social determinants. Again, the focus is action, implementation. These are the types of words we've been using all evening. And so, not only identifying the needs. That's what I started off talking about. Needs, but also setting the targets, right? So where are we heading towards? And finding, again, inspiration is one of those things that sometimes you're needing to kind of bring all of these things together, and we're presenting a lot of tools throughout this throughout the presentation, so it is challenging, but I think given the circumstances you'll know which ones are best used where. And then also monitoring. Again, important to not just implement, but monitor. Has there been progress made? Next slide, please. And so, what was done here, what we did here is created a kind of a mnemonic device, an acronym, but more so a mnemonic device, which is, again, another technique which you can use to, also tell students to use to learn things. But structure a situational needs analysis, develop your goals, orient yourself to what is out there already, and then harmonize all areas. So kind of like alignment. And the reason I use SDOH because it's really important. It's really important, but also it's really easy to remember. That's the same acronym for social determinants. So it actually is easy when you want to think about it. Next slide, please. So again, I'm not gonna go into too much detail about leading health indicators, except for the fact that these are high priority healthy people 2030 foci and objectives that should be looked at. So next slide, please. And so these are the focus for all ages. Next slide, please. So environmental health is part of this too, and we can just kind of go through this slide, but there's multiple areas. There's education level, fourth grade reading is a focus, depression, obesity, smoking. Next slide, please. So one way to, I'm going to show you concretely here, how we can use Healthy People 2030, the objectives, the target, and everything that there is. And so what I did here is actually used a kind of a red pen to mark the target. So 41.5% is the target, but according to the last measurement that was made about attending public and private schools for fourth grade students, and reading skills, specifically reading skills. The last measurement was made in 2017 at 36.6%. So you can see that the target, that there's a discrepancy between the target and what the most recent data says, which means that there is a need to improve literacy. Reading skills. And so part of what Isaac Cujo has spearheaded is in terms of creating a literacy campaign and book drives. And let's do things like this. We're already doing things. We're already doing things towards Healthy People 2030. See, let's redouble our efforts. As Walden, let's do what we do best, what we're already doing. Next slide, please. Okay, so this is the the graphic for social determinants. Next slide, please. And this is how it was compared in the past, just so that everybody can see. Next slide, please. And so this was talking about some well-being discussion. Next slide, please. And then next slide, please. So the important point there was the fact that well-being is when we're talking about student experience, well-being is something that is important. I mean, when we're talking about whether it's anxiety or mental health, and one of the things is some of this Walden student ID cards actually have listed mental health resources. And so you know, these are solutions. You know, these are things that we already do. So so concluding thoughts. Next slide, please. And so before kind of moving into the final concluding thoughts, I wanted to quickly revisit how some of these geospatial applications that we talked about and Nina talked about, you know, earlier, can really be studied as it pertains to relationship with health. So there was a significant relationship in some geospatial analysis that I conducted as part of this presentation, you know, connected with cancer, and then there's some voter turnout and lung cancer mortality, the findings of which was actually submitted to the Department of Health and Human Services as part of that appeal for Healthy People 2030. And also there's a need for additional educational opportunity. So next slide, please.
So I think we wanted to end with the toolkit. And again, I know when we look at this right now, it's like, wow, what? This is still kind of abstract, but everything that we talked about tonight, there's something actionable. And the chat, you guys have had amazing, amazing ideas. And I want to point specifically to Bill Barkley. You had this wonderful idea of triangulating disciplinary discussions. I think that is one of the most intriguing ways of thinking about this that I've seen in a really long time. But using the SDOH technique as part of Healthy People 2030, we know we have tools that have predictive modeling to help to increase, if we want to call it well-being, diversity, equity, inclusion, educational justice. We can do that. We have the means, and I think we should absolutely employ that in our research. And of course, we have another tool in geospatial applications like the county health rankings. We have such amazing tools at our disposal that we can absolutely get a move on. Because you know, it is a mandate. I think it's a really important set of initiatives to help increase the social and economic mobility of our students.
So now that we have you know, presented these tools, and of course, you've seen many of the presentations, you know, throughout National Faculty Meeting already. Many wonderful presentations articulating, you know, social determinants of health, and articulating all across the university, you know, different aspects of this, and creatively taking not only a multidisciplinary approach, but as Nina mentioned at the very beginning and emphasized this point, is that it's a cross-disciplinary approach, which means it takes you know, an effort to be able to start to build those bridges, build those connections, you know, and so using concepts like triangulation, using ideas which bring together and start to bring these ideas to flight. We're fostering social change. We're driving social change at Walden every day, you know. We represent a whole group of a wonderful, talented faculty members, administrators, support staff, all of us. You know, we're all here. We're all here. You know, locked arms, ready to support students. You know, and I think with renewed vigor and renewed efforts, we need to get our minds together and start thinking creatively. So
I think I see in the chat a lot of people are leaving, and I'd like to capture any questions that you have before you leave the room. I've told a lot of you that I'd like to reach out to you, and I am going to, and Shri, I'm going to pull you in on some of these conversations. I really want to continue the dialogue, and I think this is just kind of a beginning for us. And if you'd like to reach out to us, please feel free to. We'd love to continue the conversation. But do you have any questions that you want to ask, or comments that you want to say instead of putting them in the chat?
And you can all, if anyone wants to chime in, you can unmute yourself or raise your hand if it's not allowing you to unmute yourself.
Thank you for being an engaging audience, and again, some wonderful comments from everyone. So this is great.
Again, thank you both so much. This is Deborah. I just want to say, I hope we don't lose sight of this incredible discussion after NFM. We make this a priority when we come together for NFM, and then everybody goes back to their regular high stress schedules. I just want to, I think this is so important, and I just want to thank you for leading it. And if you can just help make sure we all continue to stay engaged, that would be awesome.
Deborah, I think you put out the call to action tonight. I think we need to figure out how to make that happen. I like that idea a lot.
Yeah, definitely. I think I think having venues where dialogue continues, Deborah, is definitely important as well. So again, a plug for having places where you're spreading awareness. So social media, like if you're involved in Facebook, LinkedIn, places like that, spread awareness.
Yeah, and I think also just within Walden, and I'm going to go back. Nina, you gave a call out to Bill Barkley. And looking at the cross-disciplinary issues, I think there may be opportunities to, and Bill, tell me if you think I'm on target here, but maybe we should have Nina and Shri come to one of our WG meetings and really talk about how do we move forward in that direction? Because I think it is really important.
Love to. Invite us to any party.
Yeah, absolutely. No, you're invited.
We'd love to. Absolutely. This is so important, and it's not just because we have a new parent company and this is the vernacular that they're using. This is something that's so invigorating, and I think it engages so much of what Walden already does and does really well. And we can have like a dedicated focus to it. Now we have a really great excuse to be cross-disciplinary. I know we've gone way over time. So thank you so much for all
Thank you for
patience.
being here. Yeah.
But please, please reach out to us. And I love all of the ideas of activism, whether it is, writing letters, or, we start new initiatives or new types of research, or using social media. I think all of these are really great steps to take.
Well, I want to also thank you for carving out time and there's a lot of time on Dr. Banerjee and Dr. McCune on this fabulous information. I know OTLE will look forward to maybe hosting a few more sessions on this. Great interest, great information. As you see in the chat, I put a link, and thank you for correcting me. One of our attendees corrected me. I had an old link, so thank you for correcting me on where to find a copy of today's PowerPoint. Diane Penland, thank you. But you can find today's PowerPoint, link to the recording, plus upcoming development sessions that you may want to go to, but maybe can't go to. We'll have recordings for all those after the fact, or if you want to re-listen to things. I know that today was packed full of wonderful information, so please know if you missed anything, you can find the PowerPoints and the recording in a few days on the link that I put in the chat. Thank you, everyone, for carving out time for your professional development here at Walden University. And thank you to our presenters one more time. I hope you all have a lovely night, and we look forward to seeing you tomorrow for day 2 of the virtual National Faculty Meeting. Have a good night, everyone.
Yeah.
Thank you.
Good night.